Hi, my name is Dr. Megan Crute and I'm a board-certified dermatologist with CallonDoc. Today I wanted to address one major issue of hair loss that we frequently get questions about, namely hormonal hair loss or androgenetic alopecia. This type of hair loss can affect both men and women. The pattern of hair loss tends to be a little different and our approaches to treatment can be different, but it is important to know about because it can affect pretty much anyone. So this type of hormonal hair loss, or like I said, the scientific or medical term is androgenetic alopecia, is caused by how your hair follicles are responding to certain hormones in your system, typically testosterone or another hormone called DHT, which is a byproduct of testosterone. What happens is your hair follicles, if they are particularly sensitive to these hormones, it tends to cause certain hair follicles to start to shrink down over time, gradually slows the hair growth in those areas, and can eventually lead to hair loss in certain areas. Now in men, the areas that are affected by this type of hair loss tend to be the frontal scalp, the temples, and the top of the scalp. It tends to start as just very gradual receding of the hairline, but can progress to full hair loss, including the whole top of the scalp in more severe cases. The timing of this, sometimes men can start to notice these changes as early as their late teens or early 20s. More commonly, we see it throughout the 30s, 40s, and 50s. In women, it's a little different. We do sometimes see some hair thinning in the temple area, but the hormonal hair loss in women tends to be more diffuse, so tends to involve a more wide range of area on the scalp. The top of the scalp tends to be affected, but instead of causing almost full hair loss in those areas, it just causes gradual thinning of those areas. So most women will come in noting that their part in their scalp of their hair seems like it's wider, or they're starting to see more of their scalp over time. It's getting sunburned more easily, things like that. It doesn't tend to involve fully formed areas with no hair. So the patterns between men and women are different. The hormones that cause it are the same. It's just the hair follicles in different areas are more sensitive than others, so that leads to the different patterns. It tends to be a very slow onset, so something that you start to notice, but it progresses over years. So if you happen to have very sudden hair loss, it's unlikely that it's only due to this hormonal component. Also, if you notice different areas that have completely bald patches, that is not likely due to just hormonal hair loss. So if you think you're experiencing this type of hair loss, it is a good idea to have an evaluation with a dermatologist so that they can make sure there's no other underlying causes that might be contributing to it. If they determine that it is most likely due to just these hormonal influences, there are several treatments that can be used, and that differs based on each individual patient, whether they are male or female, whether the female patients are postmenopausal or premenopausal. So there's a lot of things to be discussed. Treatments are typically either aimed at minimizing the hormonal influence on those hair follicles by either blocking those hormones or stopping the conversion of hormones into the active form. Or there are treatments that are just meant to help stimulate those hair follicles to grow faster, thicker, and stronger. A lot of times there's a combination used to address the concerns. And like I said, it's going to be a very individualized treatment plan. So not one treatment works universally for everyone. So if you think that this is something that you're suffering from, especially if you have a strong family history of men or women or both having hair loss, then be sure to discuss this with your dermatologist, because there are definitely things that can be done to hopefully help retain the remaining hair that you have and potentially even help to regrow some of the hairs that have been lost.